Hi everyone, how you doing? I trust you're doing well. Okay, so just want to talk to you briefly today about the benefits of antihypertensives. The benefits of antihypertensives. Um, in my last video, I talked about some lifestyle changes that you can make if you have been diagnosed or are at risk of hypertension. And if you haven't watched that, I want to encourage you to check my channel and look for that. Okay. But today, I want to talk to you about the benefits of your antihypertensive drugs. One of the challenges that we face in practice and in discussing with people is that people wonder, must I commit myself to a lifetime of taking medications? And I know that that can be a difficult thing to conceive. That's not really what anybody wants. However, there may be situations where this may be more beneficial for you um, than for you coming down with possible complications of hypertension. Okay, now if you're newly diagnosed with hypertension and it's your blood pressures are not severely elevated, yes, it's great we start with the lifestyle modifications which have been shown to actually help to improve um, blood pressure readings. However, if your blood pressures are severely elevated, we wouldn't want that in the process of trying to make lifestyle adjustments, you develop complications. And just to speak a bit about complications is for us to understand that one of the reasons why we find it important to control blood pressure is because we want to prevent or delay the onset of the complications that could come with it. And this is what we call secondary prevention. So, what are some of these complications? There could be damage to your kidneys. There is a risk of developing a stroke, a heart attack, heart failure. There could be damage to the male sexual organ, the penis, damage to the eyes. Now, one of the things we do in medicine is that we look at the benefit against the risks. Okay? So, the question I tend to ask people is that if by taking your medications we can prevent you from having these complications, then I think taking your medications at this point is cheaper than having a damage to any of these organs that I have mentioned. Okay, and this is what we call secondary prevention in medicine. Again, one of the reasons people do not want to take antihypertensives is, oh, they say, oh, doctor, I learned that it has this side effect and that side effect. And the truth is, every medication has a side effect. But again, it is the duty of your healthcare provider to weigh the benefit against the risk. Should we risk you developing a stroke or kidney failure, for example? Or can we deal, are there side effects that we can deal with? Now, one thing that people also tend to do is that when they start taking a drug, they notice a particular side effect, they just abandon it altogether. I wouldn't advise this. Why not go back to your healthcare provider, go back to your doctor, and discuss that since I started taking this drug, I noticed this. There are many other options that can be given. One common side effect that people might face, for example, depending on the type of antihypertensive, is lack of sexual drive or poor erection in men, and that can happen with some antihypertensives. But remember that poorly controlled hypertension can also damage the vessels to your penis and give poor erection. So it's important that we have a balance um, of all of this, okay? Sometimes one of the things people also tell us is that, oh, doctor, I know when my blood pressure is high, and so I don't normally take my antihypertensives. But so when my blood pressure is high, I start to have a headache or I start to feel funny, then I go and take my antihypertensive. Unfortunately, hypertension is regarded a silent killer, meaning that you can have severely elevated blood pressures without having any symptoms at all. And this does not stop the damage going on in your body. Okay? It's important that we also understand that sometimes the goal of some of the antihypertensives is not just to control your blood pressure, but to also protect your vital organs. Because based on what your physician finds from your heart and your kidneys, there may be a need for you to be on drugs that can prevent further damage to the heart, for example, or to your brain or to your kidneys, as the case may be. Okay, so I thought to shed light on this. I understand the aversion many people have for taking medications, but I would encourage us to work together with your healthcare provider while not neglecting your lifestyle changes, so that it's not like you're pouring water into a basket. If you have questions, you can drop in the comment section. I'll be happy to give a few answers. And I hope you find this video helpful. And if you know someone who will benefit from this, so why not share with them? Thank you. Have a good day. And please hit the subscribe button.